Hello guys, today we are going to discuss about a very important topic, that is erythropoietin, and let us begin. So this erythropoietin term has come from two terms, that are erythros, which means red, and poiein, which means to make. From these terms the erythropoietin has come. This is a hormone or a substance that is also known as hematopoietin or hemopoietin. So what is this basically? By chemical nature, it is a glycoprotein, and it acts as a signaling molecule for RBC precursors, red blood corpuscles precursors, in the bone marrow. A single erythropoietin molecule is having 34 kilodalton of molecular weight. This erythropoietin mainly gets secreted from three sources in the human body. In the fetal life, it is predominantly secreted from the liver. There are perisinusoidal cells which secrete erythropoietin predominantly in the fetal life, and in the adult life it is secreted from the liver, but very small amount. Secondly, it is secreted from the pericytes in the brain. Basically they are found around the micro vessels in the brain. These are the pericytes. They also secrete this erythropoietin, of course in very small amount. And then in adult life, predominantly it is secreted from the kidney. There are peritubular cells which may be fibroblasts also, and there are peritubular capillary beds. From there this erythropoietin gets secreted mainly. So these are the three sources for erythropoietin secretion. So now let us discuss about the basic functions of this erythropoietin. The main function of erythropoietin is RBC maturation and production. From its precursors. And second, there are some non-hematopoietic roles of erythropoietin also, like it helps in angiogenesis. It also causes vasoconstriction and increase in the BP, that is the hypertension. This is due to the vasoconstriction. And another thing can be seen it in ischemic tissues, that is where there is less blood perfusion. It has anti-apoptotic effect and causing cell survival. These are the basic functions of this erythropoietin. Also, some research data shows that it has it has neuroprotective property in case of diabetic neuropathy, but it is not well established and not proven clinically till now. So now we have to know how this secretion of erythropoietin is regulated. It is basically regulated by measuring the blood oxygenation and the blood iron level. So by these two, there is a feedback mechanism. By this feedback mechanism, the secretion of this erythropoietin is regulated. So now let us know about the mechanism of action of this erythropoietin. So erythropoietin or EPO acts along with some cytokines, interleukin 1, 6, then stem cell factors and glucocorticoids. They all act on the hematopoietic system and they all stimulate erythropoiesis. So in the renal peritubular cell, in the nucleus, there is a gene known as GATA2 or GATA2. This produces GATA binding protein 2. In normoxic conditions, that is when the blood oxygen concentration is normal or tissue oxygen concentration is normal, so this GATA binding protein 2 blocks the promoter region of this EPO gene, that is the erythropoietin gene. This is the gene responsible for erythropoietin synthesis. So when there is hypoxic condition or tissue hypoxia, there is suppression of this gene that causes decrease in the GATA binding protein 2 synthesis, and thus the promoter region gets free and it is stimulated, and in turn EPO gene gets functional, and from there the EPO synthesis increases. So thus the erythropoietin synthesis takes place during hypoxia. So this increased EPO level in the blood acts on 4 components of erythropoiesis. Number 1 is the erythroid colony forming unit. Number 2 is the proerythroblast. Number 3 is basophilic erythroblast. Number 4 is reticulocyte release. We'll see what it does in these components. So there is receptor, that is EPO receptor, in these precursor cells. In these precursor cells there are EPO receptors. These erythropoietin acts on this receptor and completes its functionality. So let's see how it acts. So there is a factor called erythroid burst forming unit. It basically expresses these EPO receptors, and this erythroid colony forming unit it basically increases the density of these receptors. Thus it helps in action of this EPO, we can say. So this is the picture of a bone, and this is the medullary cavity and the bone marrow. So we can see these are the erythrocyte cells, and this comes from the stem cell. So now here we are going to discuss the effects of the erythropoietin. So the first fact component was the erythroid colony forming unit, which increases the density of these erythropoietin receptors on these progenitor cells. So the action of the erythropoietin gets increased, and erythropoietin acts on the pro-erythroblast here and increases here the synthesis of the ribosomes. These ribosomes later on produce hemoglobin, and it acts on the erythroblast, basophilic erythroblast, and cause the hemoglobin accumulation and synthesis that we can see in the normoblasts. So then there is exclusion of the nucleus from the normoblast and formation of the reticulocyte. So it has a function also in the release of the reticulocyte from the bone marrow to the systemic circulation. So here it is, the fourth action. So these reticulocytes, when they come into the circulation, within 24 to 48 hours they get converted into the mature RBC, and they live for around 120 days and then they are dead. So this is the basic actions of erythropoietin. So in the cellular level, erythropoietin basically acts on these RBC progenitor cells, and they activate the JAK2 signaling cascade, and which in turn activates the ST85 pathway, and there are other pathways like P1K3, then RAS MAPK pathways. So these are the pathways by which there is formation of the erythrocytes. So according to the pathological point of view, we can see the normal level of erythropoietin in the plasma is around 10 milliunit per milliliter, and during hypoxia it gets 1000 times more, that is 10,000 milliunit per milliliter. It can get up to that, and it is the clinical significance is we can differentiate by measure between physiological and pathological polycythemia by measuring this erythropoietin level in the blood, because in case of physiological polycythemia, the erythropoietin level will be increased in the blood plasma. So we can differentiate between these two by doing this test. And in case of renal failure, and in case of end stage kidney diseases, the erythropoietin level in the blood is decreased. So in pharmacological point of view, we can say that there are two drugs which are used. The number one is epoietin alpha. This is a DNA recombinant human erythropoietin. It has a half-life of around 5 hours in the body. So another drug that is known as darbepoetin, it is nothing but erythropoietin plus 2 carbohydrate chains. These carbohydrate chains make it long-acting drug, and its half-life is around 3 times more than the actual erythropoietin, that is around 15 hours. Both of these drugs are basically used with iron supplement in case of anemia for more effectiveness, as these drugs has a late onset of action. That's why this iron supplement is given. So the route of administration of these drugs are basically in case of renal dialysis, they are given in IV route, intravenous route, and in other cases they are given in subcutaneous route also. So we know these drugs are actually used in therapeutic treatment of anemia. So we have to know in which causes this anemia occur that we use these drugs. So first of all, there may be a bone marrow disorder which may lead to anemia. Then in case of cancer related anemia, we also use these kind of drugs, and in case of HIV infection, if there is anemia, and in end stage kidney diseases, we use these erythropoietins, and prematurity related anemias. In these types of anemias, we use this erythropoietin. So what are the adverse effects or side effects of these drugs? These drugs basically cause vasoconstriction, and thus they cause increase in the blood pressure, that is hypertension, and they increase the viscosity of the blood, causing arthralgia they can cause. And if they are given for target hemoglobin, that is if the target hemoglobin is 11 gram per deciliter and this therapy is given, they are often seen to create some really bad effects like cardiovascular diseases, hypertension, there is tumor progression, and also there is some cases of deaths also. And it is suggested in the therapy that there must not be any 1 gram per deciliter or more increase in the hemoglobin level during the therapy within 2 weeks of times. And if this occurs or any symptoms occurs, the therapy has to be stopped immediately or have to be discontinued. So this was all about the erythropoietin. Hope you liked the video. So please subscribe to our YouTube channel, and please like our video and share with your friends if you like it, and like us on FB and email us your suggestions, and please comment below. Thank you guys.